I'm joined by Dr. Sarthak Rastogi. He's a consultant pulmonologist at SL Raheja Hospital, a Fortis Associate. In the recent weeks, we are witnessing sudden surge in cold and flu cases in India. Scientists and doctors have attributed most of these cases of persistent cold and fever to H3N2 influenza virus. I'm going to talk to Dr. Rastogi regarding the threats of H3N2 influenza virus. How is it different from COVID-19 and what impact will it have on public health? Thank you, Dr. Rastogi, for joining us.
Good evening.
Doctor, can you briefly explain about the H3N2 influenza virus? Like what is its origin and how is it different from other strains of influenza?
So, when it comes to influenza virus, basically it's the seasonal flu that we are talking about right now. And since 2009, when we had the last pandemic of influenza, that was H1N1 pandemic. At that time, the dominant strain changed to H1N1. But for last few years, we are having a dominant strain again as H3N2. And so basically the strains keep on changing, which is the dominant strain. And that's when we have a bigger outbreak. Sometimes if the change or the shift in the makeup of the virus is too severe or there is a very classic change, then we have something what we call as epidemic or a pandemic. The way it happened in 2009, the way it happened in 1918, when the Spanish flu was detected, it was considered to be one of the worst pandemics that humanity has ever faced. And right now, the last significant outbreak of influenza we had in India was somewhere in 2013 and 14. And since then, the influenza, it keeps on simmering at a lower level, but having an outbreak here and there. So in Mumbai, we experienced that last outbreak was in the monsoon season or the post-monsoon season, somewhere in July and August. We had a small outbreak of, and we had a lot of cases of influenza-like illness or severe acute respiratory illness. So now again, since January, we have seen a spike in cases of acute respiratory illnesses, mainly influenza-like illnesses or severe acute respiratory illnesses with which patients were getting admitted. And even ICMR has come up with the data that since December, mid of December, there is a spike in cases of H3N2.
Okay, so should we be worried about H3N2 virus that is spreading across the country?
See, in terms of worry, H3N2, like any other influenza outbreak, any other seasonal influenza outbreak, it affects people with certain diseases or people in certain age groups, especially children less than 5 years of age, and that too, children less than 2 years can experience severe illness. People who are older, above 65 years of age group, pregnant females, up to 2 weeks of postpartum, that is after delivery, they are at a higher risk of developing complications. Or people with certain diseases like asthma, different types of cancers, uncontrolled diabetes, uncontrolled blood pressure and heart diseases. These are the people who are at a risk of developing complications with influenza. Otherwise, influenza comes and goes like any other disease, but there are chances that it may become severe and people may have complications which may even lead to death. But this time, fortunately, we have not experienced a lot of complications. There are people who are getting admitted like any other flu season. I would not say there's anything alarming, but we have to be cautious. We have to take precautions, and if the patient and if the age group is right, we should even consider vaccination also.
So it is said that the symptoms for H3N2 virus is almost similar to COVID-19 symptoms. How is this virus different from COVID-19?
So COVID-19 virus and influenza virus are totally from two different families. But like any other respiratory viral infection, when they present, the symptoms and the clinical features are very hard to differentiate. The incubation period or the period from when the virus enters the body to the time the symptoms are shown is somewhere between 1 to 4 days for influenza, while for COVID it is anywhere between 2 days to 14 days also. Apart from infectivity, also varies. The COVID virus usually spreads through droplet infection and some cases of airborne transmission also. But influenza virus usually transmits by droplet infections. The fact is that it can transmit through fomites and hand-to-hand touch also. And that person who has had a handshake with the person who's infected and the hands were contaminated with the respiratory secretions, and then he goes on to touch his own nose, the infection gets spread. The chances of this happening in COVID was at a lower level, although it's still controversial. But influenza, it's a well-known fact that apart from the droplet infection, fomites and other surfaces also play a role in spread of infection. When it comes to clinical features, it's quite varied, and sometimes most of the people will experience a disease like a symptom like common cold. Some may tend to go on to have high-grade fevers, severe body aches, severe muscle pains, and a lot of people, especially in the vulnerable category or with red flags, they will experience dehydration, or they can experience other complications like pneumonia-like illness and breathlessness and respiratory failure. So very difficult to differentiate when it comes to COVID versus influenza, but we have to undergo a test at that time.
Okay. So what are the precautions that people need to take in order to stop or control the spread of H3N2 virus?
So it's like, again, like COVID, what we had heard, you have to wear mask when you're in crowded situations, in crowded public places. You have to wear a mask, you have to maintain hand hygiene. The men, avoid touching men, that is the mouth, eyes and nose. We have to take care of that. We have to clean the surfaces, especially in daycare centers for children and in nursing homes and old age homes where sick people are managed. In such places, there has to be a regular surface cleaning so that the infection is prevented. Healthcare workers, care providers, teachers, those who are giving a care to someone else, they should be vaccinated. And everyone should start considering a vaccine. Apart from these vaccination, apart from that, what people can do is, if they have a medical illness, make sure that you're on proper treatment for it, especially asthma, diabetes. If your asthma or diabetes are uncontrolled, then it's better that you start visiting a doctor, get on the right treatment, try to control your symptoms. That can have a big impact on controlling the influenza from becoming serious and giving rise to complications.
Okay. So are there any differences in the way that the influenza virus affects children and adults?
So as I said, children less than 5 years are at a higher risk of complications, especially the ones who are less than 2. And people and kids, infants which are less than 6 months are at the highest rate of complications. And an adult, that changes. Okay, apart from that, it will be very difficult for me to comment upon this, but kids usually have higher incidence of pneumonia-like illnesses rather than adults when it comes to complications.
Okay, so how is H3N2 different from other strains of flu in terms of severity and mortality rates?
So, as I said, it depends on the antigenic shift and antigenic drift that decides the mortality. So it's not that the H1N1 is more lethal or H3N2 is more lethal. It's the new number of mutations. So now, right now, what we are experiencing is we have just seen a spike of cases, more number of admissions, but the number of complications are they more than compared to other seasons? No, it's not like that, but it will be with time that we will come to know whether there is any change in clinical presentation or is there any change in mortality and morbidity of the virus. So it doesn't matter which kind of strain it is, it matters what kind of mutations it has undergone and what is the circulating virus. If the circulating virus suddenly changes, then the chances of complications and lethality rises. The seasonal virus has not undergone a lot of mutations, then the chances of having these problems are less.
Okay. So what is the present condition in hospitals regarding H3N2 cases? Like, at what rate are the cases increasing or decreasing?
So right now we have a steady, I would say, cases of severe acute respiratory illnesses. A lot of times we are not able to isolate the virus because patients are presented late and they are presented in complication stages. On OPD basis, a lot of patients are not preferring to get the test done as it is an expensive test. But we do offer it, and we do offer the treatment in cases where we have a high suspicion that this person is at a higher risk of complication. We tell them to undergo testing. So we are having steady cases. I would not say they're increasing rapidly or they're declining. The number has been steady since more or less since Feb in terms of clinical presentation, but the number of people who have got tested and isolated H3N2 that varies. So we have to understand the clinical suspicion, and it remains still the same over the last 2 months. I would not say that I've seen much of a change in that picture.
So as you said, people are not undergoing tests due to reasons, financial reasons, or due to high cost. So what do you think, how can the government help in this matter? What measures should the government take to ensure that people undergo tests?
In the past, there have been cases where the government had subsidized the H1N1 RT-PCR, that is the defining test. I would say if the numbers of the situation worsens, the government can subsidize or cap the rate of investigation. As of now, I would say the situation, government can continue. They can start spreading the message of using masks, and they can start awareness a little more aggressively. That is what is needed from the public health point of view.
Okay, so how does H3N2 impact the public health?
See, whenever there is an outbreak, the health setups do undergo a strain, and they do impact the day-to-day services. So, H3N2 outbreak, till the time it is in control, the ICU care and the dynamics will change to a certain extent. But once the outbreak, if it goes out of control or the number starts rising exponentially, then we'll be in a similar situation to what we were in 2009 or like any outbreak here where the outbreak is severe. I would not like to raise panic like 2009, but yes, definitely. Whenever we have influenza outbreaks which do turn a little severe or the number of cases start rising, then the day-to-day elective care of the hospital, of the patients which is being provided, goes under a bit of strain. Okay, so as of now, the number of admissions are not very high. So I don't think so. In terms of healthcare, anything has changed. Yes, these patients with influenza who land up in the ICU, they tend to have longer stays. They need to be on ventilator. If they land up on ventilator, the ventilator number of days goes on higher, like any other respiratory viral outbreaks, which lead to severe acute respiratory illness. But we have seen whenever there are H3N2 outbreaks, the number of hospital admissions, they do rise.
So as you said, and it is also reported that in the last 6 months, the pattern of viruses is changing. So considering that, is the health infrastructure in our country equipped to overcome such crisis?
That I will not be, I'm not suited to be the right person. I think so a public health expert or an epidemiologist or somebody from the government will be more equipped to answer. Being a chest physician in a private setup, this is just out of my expertise to answer.
Okay. So thank you, Dr. Rastogi, for joining us for your time. It's good to have you here. Thank you.
Bye. Take care.
Thank you.